Children's mental health issues require our attention, especially when children are struggling with emotion regulation and self-control. There is something we can do to help. Stop Now and Plan, or more commonly known as SNAP, teaches children and families how to stop and think before they act and make better choices in the moment. Started in Toronto, Ontario, it has become Canada's leading evidence-based early intervention children's mental health model program. SNAP helps to strengthen emotion regulation, self-control, and problem-solving skills by teaching children and families how their thoughts, feelings, and actions are interrelated. This helps to decrease things such as aggression, rule-breaking, irritability, as well as anxiety and depression in children. For parents, it helps reduce parental stress, improve effective parent management skills, and improve parent-child relationships. But why SNAP? This is the part of the brain that helps us control our behavior and manage our feelings. Studies have found that the brains of children with behavioral problems may look different than other children in these areas and can result in making them more reactive. What we know is that there are many risk factors that can impede healthy child development and well-being. Today, this is known as adverse childhood experiences, also called ACEs. These experiences can disrupt neurodevelopment, can lead to social, emotional, and cognitive impairment, adoption of health risk behaviors, including disease, disability, and social problems, and even early death. So what happens to you does matter. Today, our children are facing the perfect storm. Without access to effective mental health programs and supports, it can lead to school problems, major family issues, mental health problems, and even lead to criminal justice contact and incarceration. In 2011, we teamed up with Sick Kids and the University of Toronto and did a brain study with children going through SNAP. The study found that before taking part in SNAP, kids who displayed behavioral problems had different brain activity than other kids in areas that help with regulating behavior. After taking part in the SNAP program, not only did their behavior improve, their brain activity looked like the kids who never needed SNAP in the first place. That means that the SNAP program can produce positive changes on a neurological and biological level. Evidence shows that there are 7 years of warning before a child with serious behavioral problems can become a violent and chronic offender. SNAP uses this as a window of opportunity to intervene and help children regulate their emotions and control their behavior. Over the last 35 years, SNAP has reached thousands of children around the world. This evidence-based, gender-specific early intervention model works with communities to ensure we are culturally responsive and safe. SNAP not only works with the individual child, but with their families, schools, and communities using a trauma-informed and risk-need lens. SNAP started out as a community-based children's mental health program to fill a vital gap in services. In 1984, the Canadian government raised the age of criminal responsibility from 7 to 12. As a result, a gap developed for mental health services for children in the middle years experiencing serious behavior and antisocial behavior. It was in 1985 that the original SNAP team received funding to develop a program to help meet the needs of children at risk and in conflict with the law. To ensure that we can keep our children safe, SNAP opened its doors in November of 1985 to the first 11 children and families to SNAP clinical services. As our journey continued, we learned so much about how we can ensure our evidence-based early intervention is providing the most effective treatment for children and their families. We underwent several research studies and soon adapted our SNAP program to be gender-specific in 1996. We found out that the girls were not getting the same results as the boys and changed gears. By using a gender-specific framework for SNAP, our SNAP girls benefited from the adapted clinical curriculum. By emphasizing communication, relationships, and adding a feminist lens to recognize gender difference, girls were better able to decrease their aggression and disruptive behaviors. We also became a continued care model. This means that we continue to provide children up to the age of 18 and their families with the needed supports based on their risk and needs. As part of a scientist-practitioner SNAP principle, where research informs practice and practice informs research, we developed different assessment guides such as the Early Assessment Risk List, otherwise known as the EARL. The EARL is a risk assessment guide that helps organizations determine the child's level of risk and need. The EARLs help to capture adverse childhood experiences to inform clinical risk management plans. The first version of the EARLs was produced in 1998 and subsequently adapted over the years to ensure it remains current. We believe that every child and family deserves to have an evidence-based early intervention solution such as SNAP in every community. As a result, in 1999, we launched the very first Community Referral Protocol. This protocol brought together community partners and stakeholders, police, child welfare, schools, fire service, community-based organizations, to create a safety net so they wouldn't fall through the cracks and to ensure that children and their families who needed SNAP could access it in a timely manner. This all led to the development of SNAP's comprehensive children's mental health and crime prevention model. In 2000, we partnered with McConnell Foundation to create the Center for Children Committing Offenses, otherwise known as the CCCO, now known as SNAP International Headquarters, a dedicated unit for SNAP implementation, development, and knowledge exchange. During this time, we licensed our first SNAP affiliate. In 2008, Public Safety Canada designated SNAP as an effective program. We've been growing across Canada and internationally. It is with the support of various stakeholders, government, research scientists, individual donors, foundation, and community partners that we are where we are today. In 2012, LEAP, PICO Center for Social Impact, chose SNAP as its inaugural charity. This helped bring more donors and partners together to help expand the SNAP program under the SNAP National Expansion Project. By expanding the SNAP model across Canada, we are helping to fill a vital gap for children in the middle years, ages 6 through 11, with mental health issues. Today, Child Development Institute's SNAP International Headquarters is the main hub for SNAP implementation, research, development, and training activities for SNAP and the SNAP National Expansion. SNAP HQ identifies, connects, and builds relationships with community organizations in regions across Canada needing services for children and families. Over the years, SNAP HQs have developed a comprehensive implementation framework that ensures SNAP affiliate sites are supported throughout their SNAP journey with ongoing consultations, training, fidelity, and outcome monitoring activities. In addition, culturally sensitive program materials and state-of-the-art technology is available. With 35 years, SNAP has become nationally and internationally recognized, with over 100 SNAP affiliate sites around the world servicing thousands of children and their families. Since the start of SNAP's journey, it has received 43 awards and designations and has produced over 151 publications. Children's mental health continues to be an ongoing issue that we need to address. We need to ensure that our children and families get accessible and timely evidence-based services. By working with government, foundations, donors, and community partners, we create massive social change in children's mental health for children around the world. To learn more about SNAP, please visit us today at stopnowandplan.com.
Hi, this is Lena Ajamari, Director, SNAP International Headquarters, the Center for Children Committing Offenses, and one of SNAP's co-founders and developers. I hope you enjoyed learning about SNAP's first 35 years. It has been an incredible journey of learning, lots of listening, sharing, and building within a scientist practitioner framework. Often, I also refer to this journey as the climb. To our incredible SNAP children, youth, parents and caregivers, and families, it is such an honor and privilege working with you. Thank you for trusting the SNAP teams, sharing your stories with us, and working together to improve one's well-being, mental health, and life chances. This climb I like to refer to has taken perseverance, grit, passion, and courage, and a lot of heart to grow an evidence-based children's mental health and crime prevention model. It comes with a skilled, passionate team of professionals, and for all those who've been part of SNAP's past, present, and future, thank you. So how did SNAP start? SNAP, the strategy, got its roots initially in our day treatment classroom in the 1970s with a simple snap of the fingers, thanks to Barbara Dubois, one of our team members, and Jack Polanski for pioneering our original Transformer theme. As we saw in the video, a change in Canadian law and a gap in services provided an opportunity to create something new to meet the needs of these children and their families. To those that planted the seed to bring SNAP to life and helped create our SNAP evidence-based model, thank you, Kenneth Goldberg, Kathy Levine, and Dr. Deborah Pepler, and my first two SNAP colleagues, Camille Hannes King and Elizabeth Leggett. It does take a village. This thanks is extended to our team at the Child Development Institute, home of SNAP. Thank you to our SNAP clinical, research, implementation, administration, senior leadership, and board of directors. And a very special mention to our CDI SNAP clinical lab team members, past and present. Seeing you in action, whatever position you hold, and seeing you put your heart and skill into all you do. Whether it's seeing you coach a child in the hallway for a role play, watching you interact with a family, greeting our children, youth, and families when they come to a SNAP door, or seeing your passion in meetings, case conferences, conducting intakes, group, or even cooking a meal together with our youth. Thank you for your incredible dedication to our SNAP children, youth, and families, and making such a difference in their lives. To the SNAP International Headquarters team, responsible for all things pertaining to implementation, research, development, systems, and dissemination. Thank you for your dedication to SNAP and the children, youth, families, and communities we have the privilege of working with and being invited into, making sure SNAP is implemented with the highest fidelity and integrity in order to achieve the best possible outcomes. You rock. How do I even begin to thank our awesome SNAP International Headquarters leadership team? Thank you for ensuring excellence in every possible way leading our SNAP journey. A special thank you to Nicholas Slater, Margaret Walsh, Manny Wong, Melissa Syme, Aaron Reitza, and Dr. Reddy Smaragdi. The words perseverance, grit, passion, courage, and heart describe your commitment to SNAP to a T. A special thank you to McConnell Foundation for being one of our first SNAP champions who really believed in us and helped us establish the Center for Children Committing Offenses, CCCO, a dedicated training, research, and SNAP dissemination unit. It takes incredible people to make magic happen. Nancy Ham and Lynn Baptist pushed for the CCCO, and then Lynn, along with Janet McPhail and the Honorable Margaret McCain, sparked that magic again by being our SNAP National Expansion Campaign co-chairs that enabled SNAP to begin scaling across Canada. To our incredible SNAP research scientists and evaluators, no words can ever thank you enough for how your research inspired the development of SNAP and then our own research. From pre-post studies to long-term follow-ups to quasi-experimental to randomized control trials to cost-benefit analyses and criminal outcome studies to neuroscience and meta-analysis and even implementation science. Whether it was in the field of developmental psychology, sociology, criminology, risk assessment and prediction, children's mental health, youth justice, crime and deviance, your unwavering support was constant. And look at all the great things that have been gleaned from mining the data and information, helping us understand what we needed to pay attention to. What our SNAP children families need? how to manage risks, how to do good clinical risk management, what were the active treatment ingredients, whether benefits outweighed costs, criminal trajectories, what works, what doesn't, can we scale, should we scale, what makes a successful SNAP site, can it be replicated, should it be replicated, and how to build community capacity. You believed in SNAP as much as we did because you saw something special. Each of you added a special lens to it, and each of you believed in SNAP, the Child Development Institute, my team, and I. So the little engine that could kept climbing that mountain because each important piece that you contributed gave us the courage and support to keep digging deeper. And for that, we are forever grateful. To our incredible SNAP champions that include government, business sector partners, and donors, it truly takes a village, and you are absolutely part of this village. A village that includes each and every one of you because we need you. Building a bridge between an unmet need and a solution takes each and every one of you. As it has been said, early intervention traditionally delivered by community organizations have one of the highest rates of return of any mental health spending and should be a significant area of focus. Thank you for trusting and investing in the Child Development Institute and SNAP. To lead PICO Center for Social Impact, the opportunity to partner and be your inaugural charity of choice to expand and amplify our SNAP impact and reach across Canada has been such an honor. Being selected is one of the major highlights for SNAP and catapulted or leaped us to the next phase of our SNAP journey. Onboarding incredible business sector partners that we've had an opportunity to work with, like BCG, EY, McCarthy Tetrald, Offord Group, Hill & Knowlton, and Cossette. Last but not least, to our SNAP affiliates in Canada and around the world, thank you for choosing and bringing SNAP into your community, for trusting the Child Development Institute and the SNAP International Headquarters to work alongside you in your SNAP implementation journey, for working to ensure SNAP is delivered with high fidelity and integrity to ensure the best possible outcomes for the children and families you serve, and making SNAP yours. As our SNAP Cayman Island affiliate and colleague Michael Miles has said, our kids are facing the perfect storm. Each and every one of you plays a critical role in helping to navigate our children and their families through it. Thank you. As you can now see, it truly has taken a village over the last 35 years to take a program like SNAP and get it to a point where it is today. I'd like to end with this quote from Dr. Seuss, as it reminds me of each and every one of you. To the world, you may be one person, but to one person, you may be the world. Thank you.